Good morning, everyone. Welcome to Activista Rise Up. I am Dr. Patricia Campos-Medina, your host. You can listen to this episode on all my social media platforms or on Spotify or Apple Podcasts. I want to wish every woman out there, every mother out there, a happy Mother's Day, and to celebrate and elevate all the women who are elevating their voices in support and in defense of our reproductive rights. We had a very serious announcement last week that we are going to be facing challenges to our ability to make our own choices on our body. So we had a discussion previously on that issue. So I invite you to look back and check out my interview on Latinas and reproductive rights, which is very insightful in what we need to do and what it means. But today, I also have another amazing Latina woman joining us to talk about all the policy issues that matter with another great leader right here in New Jersey, but also nationally on the issue that impact Latinos and Latinas in the United States. We are going to have an amazing leader, Jesselly De La Cruz. She is the executive director of the Latino Action Network Foundation. So I'm going to ask Jesselly to come to the front of the screen and join me for this great conversation. Jesselly De La Cruz is Dr. Jesselly De La Cruz, just like me. Congratulations.
Yes.
I am a big believer of putting our title before our name.
That's right. And I really don't like being called Miss. Eso como me molesta.
Sí, soy una doctora, me lo gané. You are a clinical social worker in New Jersey, but also have a degree on the political science. So we are a little bit of we are sisters in having the discipline of political science beside our degree. So it's exciting to have you join us, Jesselly, for this conversation.
Thank you. Thank you for having me. I've been a huge fan of yours, Patricia, for decades, actually. You know, you were definitely a role model. I remember you when I was like 22, 23 years old. I think that's the first time I came across your work. So thank you for having me on the show. It's a great honor.
It's always amazing to me to see young women like yourself evolve. I remember meeting you very young, and you were you were a governor fellow. We can talk about that later.
Right.
But it's amazing to me, and that's what it's all about, right? Like inspiring the next generation of leaders and figuring out how we can work together to build things up. So tell me a little bit. You are the executive director about for the LAM Foundation.
Yep.
And first, tell our listeners a little bit about what the LAM Foundation is, and a little bit of the history, and then we can talk about what we're working on.
Okay. Yeah. The Land Foundation is a 501c3 nonprofit organization. We have a sister organization, which is a 501c4, the Latino Action Network. That is pretty much the premier Latino civil rights organization in the state that organizes communities and groups from across the Latinx diaspora countries, disciplines from the business community, to government and nonprofits and just your everyday person. And we pull together leadership and take a stance on important policy issues. So I run the day-to-day operations of our foundation. So the Land Foundation was founded in 2010. It was pretty much dormant for about 6 years. My predecessor was Daniel Santopietro, who is a longtime advocate as well. And he was a mentor of mine in this work. And he served for 1 year. And then him and my board chair, Frank Argori Freire, reached out to me when they saw that I had graduated from Rutgers to see if I would kind of work with the foundation. At the time, I was working full-time at a hospital, providing mental health services. So, I took the job, I took the job. So initially in 2017, I started. I was pretty much doing it in the evenings and the weekends. And it's grown a lot since then. So when I took on the organization, our funding was at $250K. Our main program is the Hispanic Women's Resource Centers, which was a program that was established by legislation in 1991 to support the unique needs of Latino women in terms of employment and training services. And these 3 centers had been historically functioning for years successfully. They were cut during the Christie administration. And LAND, the 501c4, advocated for 6 years to restore its funding. And in 2016, I don't know what Christie was like. You know what? I'm leaving. I guess I'll just, well, I agree. We'll
I
give
do
you,
something nice.
yeah, it's been 6 years of like just really tearing apart everything in the budget that would attach to the word Hispanic or Latino. I mean, to me, those were really specific targeted attacks.
Mm.
Um, a political targeted attacks towards funding for communities that really um, doesn't cost the state a lot in the grand scheme of things of what their budget is, but actually helps everyday people a lot. So now we are at $1.5 million in terms of funding, and sometimes I can't believe it, like, how much it's grown. Then now I'm working full time for the foundation. So we now have we fund 4 community agencies: the Morris County Organization for Hispanic Affairs, La Casa de Don Pedro, Community Affairs and Resource Center, and the Hispanic Family Center of Southern New Jersey. And they serve 6 counties throughout the state, and we reach about 3,000 women through our employment and training services. And these are very unique kind of services. This is not DOL. Let
Yeah,
me just kind of learn English, get you a certification, and be on your way.
yeah,
We're working with a population that is often excluded from major programs and funding and initiatives, unemployment and things like that. So we have to be very creative in how we promote the participation in the economy of these women who are here to also work and raising families and wanting to better themselves despite the obstacles.
I wanted to highlight how casually you said, the organization was dormant and they asked me to work, and we increased funding for 250,000 to over $1 million. I mean, that is, you said it so casually, but that actually takes vision and it takes leadership to be able to do that. And I know that you have a board
I do.
that is very engaged and trying to figure out how to create an organization that builds up on the power that the Latino community should have. But I want to say that what you have done takes vision and
Yep.
it takes leadership to be able to know what you bring to the job, but also where you want to go. So tell me a little bit about you. How did you a little bit? I know you're a clinical. You're in the mental health.
Yep.
In sphere, that's where you came. But tell us about you. How did you come to know Frank Frere, who we all know and love, and
Yeah.
how does he say, Jesselly, come join us, do this work?
Um, so, so a little bit about me. I'm 39 years old, U.S. born Latina. My parents immigrated from the Dominican Republic, but that's kind of like just a part of the story. Actually, the first person in my family to come to the United States is my grandfather. He came in the early 1960s and settled in the Bronx after the Trujillo regime fell. He was in the military. My dad's side of the family was in the military in DR during the regime. And my mom's from like the countryside, more rural Dominican Republic,
Yeah.
what they call it, Cibao. So my grandfather came here, and then really in fleeing persecution for the tragedies that occurred in Dominican Republic. And then my dad came, and then my mom came, and they met here. They were low wage workers working in like Union City somewhere in embroidery factories.
Yes.
My mom was a seamstress. My dad was, factory work. And over the years, I have an older sister who is lives in Pennsylvania. She has a different mother, so we're half sisters. And she has a son. She had a son at the age of 16. My nephew is 30, and my nephew has 2 kids now, one on the way. And they're half African American, so like very blended there, Puerto
Very
Rican,
mixed.
African American, Dominican, you know what I mean?
Yeah.
And then I have an older brother, 4 years older to the day, and he graduated from Montclair University. He works in healthcare administration. And then myself, I was the youngest, and Hudson County, kind of born and raised. With all the struggles that come with that. I lived in a time when my parents were undocumented up here. You kind of came temporarily and stayed longer than you planned because of situations and things like that. And my family did benefit from immigration policies that believed in keeping families together. So my mom was able to get citizenship based off all her contributions to this country, or her earned pathway, and having children born in this country. So she was able to gain status. My dad was never really kind of for it. He became a resident, but was never really quite ready to give up his Dominican citizenship, even until his passing. So I went to college. I graduated from Rider University. I studied political science because I've always felt like I needed to understand the way this country works and doesn't work, and for who it works and for who it doesn't work, because I felt very impacted by systemic issues myself.
Yeah.
And I was a governor's Hispanic fellow in 2003. I worked for the Division of Elections with Ramon De La Cruz.
Yes.
We developed the first voter education guide in Spanish for people to understand the process of how to run for office and what the whole process and how to get in contact with us. That was an effort that I worked very hard on with him to do. And then I graduated and I got a job at the Hispanic. I was desperately looking for a job, by the way. My mom, when I went to college, I wanted to study music. And my mom was like, tú sabes que nosotros somos pobres. Like,
Eso no paga.
she was like, girl, we've been trying to get you here. And we are tired. Like, it's your tag for this relay race. You know what I mean? It's like, tag, you're it. And I was like,
You probably told you go be a lawyer or an engineer.
that was the idea. Lawyer, business, finance.
Doctora.
And I was like, what am I going to do? You know, because the role modeling isn't there, right? Like those conversations. And I wasn't really in a school district that it was just overburdened by the number of students like me and the number of complex issues. You know, I came my freshman year, we had 800 students. 50% of us dropped out by the time I graduated. You know, like I come, you know, metal detectors, you know, community violence, gunshots, you know, I grew up with all that. In reality, I know people look at me and they're kind of like, what? And it's like, no, I grew up in the 80s and 90s in West New York when there was, you know, it was high community violence, you know what I mean, at that time. So I just didn't think I had those skills. So, you know, I went and started working at the Hispanic Directors Association. I found a job right out of college, and I was a program project manager. I don't remember, but it was my first job, and it was at a nonprofit. We did statewide advocacy on social services for Latinos. There was a network of 33 Latino community-based organizations throughout the state, some of them that I mentioned earlier. And my job was to maintain relationships with these member organizations and organize trainings for them to build their capacity on the ground for the services. So that was kind of my introduction to this work. I was thinking about law school, thinking about how to advance myself. And I kept meeting all these people like David Matos, like Elsa Candelario, who had these degrees that said MSW, and I saw them being lobbyists. I saw them running nonprofits. I saw them advocating for policy. And I was very inspired by that. And I said, you know, that's what I want to do. At the time, I remember sitting in HDA and looking at Daniel Santopiet, and I was like, how do I get there? You know, how do I get there? That's what I want to do. So I started social work school. I entered social work school at Rutgers. I worked in HIV outreach in Newark. Then I entered mental health services. I was also working in grad school. So I worked for the Latin American Legal Defense and Education Fund. I was actually their first staff member under Charo Juega, who was also a strong woman, mentor of mine. And I was doing community work. I was, you know, taking people to court to help them translate, visiting detention centers for people who had been recently detained and their families couldn't go visit them. Helping prepare taxes, ITINs, all that kind of stuff while I was in grad school. And my last semester in grad school, my dad got sick. He had a stroke at work. He was the head of household, and we almost lost him, but he survived the stroke, but was pretty much permanently disabled after that. And I became head of household. So we, you know, rallied together this was before ACA. This is why this stuff matters, right? Like this is before affordable health coverage, before we had that. We waited 8 years on a waiting list for housing You know, like they didn't have insurance for 2 years. So I was paying medication. We were paying medications out of pockets. We were paying market rent, you know, and I was freshly graduated. So I had like, I've always worked 2 or 3 jobs
Yeah.
in the field.
Yeah.
So I started hospital work in a community mental health center. Even working in the ER, I did in-home therapy. Any job that I could fit my hours into, like I would get it. And it served me well. It was people told me that's too much. You can't do that. That you're gonna burn out. There were periods that could happen because the population I like to work with is my community. You know what I mean? It's not so that comes with a added stressor. So I personally entered therapy at that point in time. I entered family therapy. I started a process for my own wellness
Good.
because of that work. And then along the way, I've had like all these trainings. I feel like community work is very minimized. So people often think that you're getting less quality service because it's free.
Yeah.
And I was very committed to being the best, one of the best providers in the community for free.
Yeah. Yeah.
Okay. So like I'm very specific about that. I'm like, if you want to pay for services, don't come to me. Okay. Like I work in the community. That's not the work that I'm committed to doing.
Yeah.
So I got every training and certification that I could to work with the community. I did juvenile justice work, all that kind of stuff.
Yeah.
My clinical concentration is child sexual abuse
Yeah.
treatment and prevention. So I work heavily in child welfare and sexual assault services. And then I got a doctorate. Don't ask me why. I decided to go and get a doctorate degree.
Yeah, that's what I said. Don't ask me why I got a doctorate, but you did it.
I did it. I survived. I worked full time the whole time,
Yeah.
supporting and taking care of my family. I graduated. And so actually during that time that I was in the ground in the mental health field, those were the Christie years. So I
So
was
a lot of issues you were dealing with, but those were some hard times for the Latino community.
yeah, you were seeing programs cut all the time, not having like even people who would have access to a little bit of prescription coverage, they would be lost. You know, like it was really tough. So I wasn't so involved in the what I call the macro policy work, like this large scale work. I was on the ground, treating clients. It wasn't until I reconnected with Frank like 15 years later on Facebook and LinkedIn and stuff, and then they saw that I had graduated from Rutgers and got my TSW, it's a doctorate in social work. It's an advanced clinical degree. And I published and did all that academic stuff. That then they asked me to come on board to do this work. And you could tell by my work history that I probably like my judgment is not the same as other people's judgments. So I'm like, oh, that sounds like a tough job. I'll take it.
Yeah. Well, I think that what it shows to me is that you live through all these issues that our communities lives through, so that you are connected to it on a deep level because it's personal, right?
Yeah.
So that you're not just talking about it, you have experienced it, and you know what it is like to go through all those different phases that you mentioned, from being an immigrant, from being a low wage worker, for being impacted by serious health issues and having to manage that, in your family, and it still follow your dreams and be able to build your own career. So I applaud you for that commitment to yourself. Also, I got struck when you talk about how you had to take time to take care of yourself, because we don't do that a lot as women in general. But if you are a woman in the social service or in the social justice world, we usually are struggling ourselves and just keep going. So I applaud that you took that time. I also want to highlight something that you said that inspired me to do this podcast at the beginning of the pandemic, which is that you actually didn't have role models to know what professionally you wanted to do in your nucleus family, right? So Santos Prieto, Frank, and other leaders became your role models. So that I think is important to elevate, because a lot of our children don't have that, and they don't. I truly believe in that you cannot be what you cannot see, and elevating all the leaders that are doing this hard work, I think is important, so that our kids get to see that themselves in those different roles, right?
Yeah, and it's like, and I credit It's so interesting. I don't know if there's a woman. Her name is Gloria Bonilla Santiago,
Yes,
and
the
she's
professor.
the
Yeah,
professor. She established the legislation on the Hispanic Women's Resource Center. She was the pioneer, and she was one of my teachers during the Hispanic Fellows Program. And she told me something that has stayed with me to this day. She said, "If you are good at what you do, people will find a way to pay you."
yeah,
And ever since she said that to me, I was like, boom, that's all I have to focus on. I
yes.
just have to get good at something and I will be okay. That was like literally my thought. And that has stayed true, which is why I've been really dedicated to my education, to my craft, to the work. Um, because to me, that was like my stability, like
Yeah.
my ability to be able to break through in the field.
I always said the same thing. I always said that the only capital that I have is the credibility of my work and the credibility of my word. Like when I said, I'm very careful as to what do I commit to do, or I don't, because at the end of the day, I don't want to be somebody who says I'm gonna do A, B, and C at the end doesn't get done. And also that if I'm gonna do something, it's gonna be the best product, So I totally believe in that too. Like that's the only thing I have, my
Yeah.
credibility and my words. So I do remember Professor Santiago. She's still at Rutgers in Camden, and I think she's being a pioneer of Latino studies in New Jersey. So um, I'm like maybe I interview her next. I'm gonna see if
It's
she
a
wants
great
to.
legacy. To me, it's to me, I have an honor. I feel
Yeah,
honored to have this legacy,
yeah,
to continue this legacy of her work through the women's centers at the Land Foundation.
yeah.
It really does take a village.
Yeah, it's amazing. It's amazing to see all the connections. I mean, in New Jersey, the Latino population is 20%. It has been growing, but there's been some constant leadership for the last 25 years, and trying to build power for the community. But before we get there, I think one issue that you and I got connected on, and I think one of our first conversations that we had was on this issue of mental health and our young people, specifically around young immigrant kids who come into this environment. And I mean, I'm an immigrant too, you're an immigrant, but the the lack of services right now for the population and addressing the mental needs are important. So how are you connected still to that work?
Right. So right now, we did have a Latino mental health roundtable last year, policy roundtable. That's how I got into it, was learning about this macro mental health services, and that there's a lack of providers that speak the language who can treat the community. Um, so I was like, I'm gonna join the army. I joined the army of that. And now we're trying to grow that workforce. To me, that's a workforce issue. But the im- first of all, immigrant children, that's a significant age in terms of finding ways to support them. I always, when you think about working from like this oppressive anti-oppression stance,
Hmm.
I've always been really upset about the way in which we treat immigrant youth like adults,
Yeah,
right?
yeah,
So we don't, so young people come here 16, 17, and they're in high school, but they're working in the restaurants, in the community, with other adults, you know what I mean? And then when they need services, like mental health services, the ones that we have for them end for them at 18.
yeah, yeah,
But for most of the general population, they can continue up until 21.
yeah,
But for some reason, when it comes to our immigrant youth, at 18, we decide that they're adults. We don't give them that young adult privilege that US born children have
hmm,
still
hmm,
within our system. And we need to work on that. And the problem is that uh, we really need to dismantle a lot of the things that we privilege as knowledge. Number one, what mental health services look like. The way that mental health services are traditionally practiced is from a very white
yeah,
perspective, where we believe that talk therapy and talking is the only way that people can heal and get better, when in reality we have tons of research that that isn't the only way that people can heal their mental health. Cultural participating and connecting to your culture of origin, and these ancestral practices, like, you know um your traditional dances or your,
Music,
music.
ceremony.
Like I did a couple of those. I have my folk Dominican dresses.
Yeah,
like we did
yeah,
all those things. I did like castaño and like things that are part of our heritage.
yeah,
That we, for some reason, it's thought that we should lose that when we come here.
yeah,
Actually, those are spiritual practices and ancestral practices that are very healing for uh, racial trauma and for
yeah,
trauma, period. But we don't privilege that and we don't fund that.
yeah.
And we fund by service per session somebody to sit there and talk to you about what you could do better to improve your life in these dire because that's really and what's wrong
Yes,
with you
yeah, and
that
you,
I
yeah,
could bill for
yeah.
to justify why I'm even taking the time to get to know you. That's really the mental health services that we have.
What you're talking is sort of that cultural nuance of understanding our community and how to address their mental health needs. Because one of the biggest issues that our youth in general suffers is the whole issue of family separation and not having the language to communicate with their own, perhaps they have been separated for years from their mom and dad. So, or they
Mhm.
suffer this violent, traumatic separation from their loved ones, and then they come here and they don't know how to talk about it. So just telling talk doesn't really help. You have to sort of embrace them and make them feel proud of who they are. So I like that. I like that you make that cultural connection
Yeah.
to creating community. That's creating community for people. Yeah,
And that's what really breaks isolation. You know what I mean? When you think about trauma and mental health issues, those things are stored in the body. So
yeah,
the solution is not to talk it out.
yeah,
It's to really move it out and feel it out and all those kinds
yeah,
of things. And yeah, it takes a lot of work
yeah,
to attach. What happens is that those attachment bonds break. If we did just have Mother's Day, so we know that, like, yeah, you might go a period where you may not see your kid. You got to go to work. You
yeah.
got to drop them off at school. But when you come back, you can make that up. But imagine that break being 10 years
Yes.
just because you didn't really know how long, you don't really understand what your parent is going through and decide to get you to come
Yeah.
here. And kids, they make up a lot of stories in their heads. So we don't really have not a lot of practitioners really work at reaffirming those bonds in ways that work.
Yeah. Yeah.
That's a big problem.
So mental health it is one of the biggest. I think it's an important priority for our youth nationally. By here in New Jersey, it's critical for helping them uh, nurture their potential for the future because it's like it's high school, it's middle school.
Yeah,
So I know that for Land Foundation, education and educational access and all those
yes,
issues around education is a very important priority. So why don't we sort of uh, jump into like what land um, I know we have a very many policy areas, but one
yeah,
of them I know is the policy reform issue. So, um, does the issue of mental health fall into that? Tell me a little bit about the policy area and education for Land Foundation, and then where does mental health falls in that?
sure. So the Latino Action Network filed lawsuit against the DOE in 2018, that there was still de facto segregation in New Jersey based off their own data. This isn't outside data. This is based off their own data that New Jersey schools are still segregated by race and class and ethnicity in New Jersey, that there are still very large pockets of Black and Latino students concentrated in schools that are more than 75% non-white,
Mhm.
right? So on the books, New Jersey was one of the first states in the country to outlaw segregation, to have in their own constitution that segregation cannot happen in New Jersey. However, we have another rule on the books that indirectly creates this segregation because we force students to go to school where their families can afford to live.
Yeah,
So if you think about historically the ways in which we have marginalized Black and Latino communities and exclude them from having access to things that create wealth, right? Like housing, like homes. This is how we now have a system where our children are overcrowded in schools that the funding does not match what the need is. So a lawsuit was filed in 2018 that the state must remedy that. And The court hearing, that was 3 years ago. The hearing what just happened in March, and we're waiting for a decision any day now. So this is like critical. This is Brown versus Board. This is really the heart of the civil rights movement that the Land and the Land Foundation are at the center of right now. And we are waiting for a decision, and my question is, I think right now the state is, and this is public knowledge, the state is arguing that separate is equal,
Yeah, yeah,
and separate is not equal. That they're not saying that their data is wrong. Their data is their data, but how somehow that still students are getting what they need,
yeah.
which we know that separate is not inherently is not equal. So we're hoping to get a decision of liability, that the state is going to assume responsibility for making the efforts to start to desegregate our schools and expand opportunities through, there's various solutions. So the solutions are, to me, there's two systems, right? There's what happens outside of the school, basically where you can go, how you access the school, do you apply, is it county based, can I get a bus there, can I have transportation there, whatever. And then there's the things that are happening inside the school. So diversity of teachers, right? Having teachers that are paid well, paid appropriately, trained to work with students of all backgrounds, because many teachers are not trained to
Yeah,
work with students of color and immigrant children and Latino children. They're not, and they're there to teach, right? They're
yeah.
not really there to be their social worker. So it's can feel very overwhelming to try and teach somebody who
And that's
maybe.
also a problem, the lack of uh, teachers of color and no teachers
Yes,
from our communities in our school systems. Yeah, yeah,
exactly. I mean, how many students? So over throughout this work, we've been organizing, we've been doing outreach to the community to let them know, hey, there's this lawsuit. By the way, there's segregation in this community. Did you know that? Most people don't,
yeah,
because they're living their everyday lives. And if you're an immigrant family, you're coming here, you're going to work. You're not thinking about, oh, like, is my kid going to a segregated school that's underfunded compared
yeah,
to that community
yeah.
that maybe I
And
go
they're
work
not,
in?
yeah, and they're not. They don't know the different services that other schools are providing,
Yeah.
that the schools where they live are not providing, because they're underfunded. So
Right. And it can feel, and the way that privilege works, it can make you feel like this is not a place for me. So
yeah,
even if your kid could go to that school, when you enter it, you feel out of place.
yeah,
And I think that's the work that needs to be done inside the school system. So inside the school system, what we've been hearing with our youth, we've been reaching out to youth and organizing youth around this work, with our youth organizer, Valeria Pozo, who's great in this way. She's a
yeah,
DACA scholar. She has all this lived experience as an immigrant student herself.
yeah,
And what we've been hearing is things that are like, we want mental health services because I'm stressed out. We don't have access to quality food in our school that meets maybe our religious or dietary needs, right? Gluten free. Some of our kids have these real needs, and we should meet them. That's not just for the rich and the white and the wealthy.
yeah.
That's and
And for
discipline.
our children, I feel that issues of mental health, or disciplinary and behavioral issues that come together with mental
Yeah,
health become a pathway for putting kids into this pathway into criminal. They get blame a problem child, or they get referred to to the criminal justice systems. It's like the beginning. If you don't address the mental health, the behavioral issues, and they turn into disciplinary issues, then you're basically just punishing them for
yeah.
for for the reality of their lives. You're not addressing their needs in the schools.
Absolutely. And let me tell you why, I guess, what my vision is, and what fuels the work that I do and how I intersect everything. Because the issue is the DSM, which is how we classify mental health disorders.
Mhm.
That is a book that is, first of all, completely political, right? All those diagnoses are based off how social order and how white people feel that we should behave,
Mhm.
right? What the message is. Oh, you're moving too much, you have ADHD. Oh, you're too angry for too long, you have this, right? And schools, they jump on that, right? They're controlling social order, so they're like, no, you're here and you have to behave like this. And children who don't behave like this, they fall into these categories of then being labeled and punished or classified with the best is when you classify a student and don't provide them the services, right? So
Exactly.
you're like, oh, you're so behavioral and you're so oppositional that I can't even have you in the school, but let me not figure out how to send you to a school that can actually work with you, right?
Mhm.
Like,
Mhm.
so we do this, and that's really this racist,
Yeah.
structural racism that we're talking about and that we have to actively fight, right? Because if someone like me, who's a social worker and trained with all those letters, says that's based, you're not taking into account someone's cultural context, someone's
Yeah.
experience, that they come from living somewhere where they can just go to the store and maybe come like more rural to coming into this urban box, and what that means for a child, that some kids are hyper.
Yeah.
That's not a disorder.
Yeah.
Not everybody's the same, and
Yeah.
we don't all have to be the same. And maybe you really upset that kid, you know what I mean?
Yeah.
Because of the way you talk to them. If children at school, like, they'll talk about how they are very talked down to
Yeah.
by teachers. It's very much like keeping this rule under your thumb. It's very prison mentality, and
Yeah.
it's almost like that's what we're conditioning our kids. And I don't think, and that's, and I would say in these segregated schools, how we condition our kids. I don't see these discipline, and as a matter of fact, the data shows this. You
Yeah.
can have an integrated school and have a huge disparity in disciplining between white children and children of color.
Yeah. And I think that the issue is what type of services do you have to be able to help these students manage some of these issues, right? Because
Yeah.
in poor communities where parents, I mean, I lived there. My parents had 2, 3 jobs. I
Mhm.
they care about whether I did my homework or I went to school, but they were not equipped to deal with some of the issues that you know that perhaps they needed to be engaged. I feel lucky that we were able to survive. Uh, that lack of parental involvement in everyday matters, and that was
Yeah.
just the way things are. They were working, um, and but we had an extended family that could help us. So I feel like where our schools are located and how much funding they have, it's just a matter of how are we caring and how we addressing the needs of the children. So I know that we have a lawsuit in place and that we're waiting for that. But in the meantime, we are pushing for some other policy solutions.
That's right.
And so why don't we and how can people get involved in supporting the lawsuit and supporting the agenda of education reform for the Land Foundation?
So you can follow us. You can subscribe to our website, landfoundation.org, and you'll receive updates around the work that we're doing and calls to action. Right now, the main piece of policy that we're looking to abolish, which is the zip code barriers, basically removing this requirement that you must attend school within the zip code of where you reside based off your residence.
Yeah.
I think we spend a lot of money policing residencies. Like, we actually staff people in our schools to be like, where do you live?
Yes.
And let me tell you something, Dr. De La Cruz, for half of her school career, lived in one community and went to school in a different community, just because we moved a lot.
Yes.
And in this town, I move across the street, I'm in Jersey City. I move across the street, I'm in West New York.
Yeah.
And I'm not going to get pulled out of school every 6 months because we can't keep up with our rent because of what's going on in our community.
Yeah.
So I was frequently taking buses to go to school all over Hudson County so that I could have an education. You know what I mean? And I
Yeah.
think that a lot of families are in this situation where they're forced, because of these municipal lines and all these municipalities. We have 565 municipalities and like 600 plus school districts. So the goal is really to consolidate some of this, to maybe some regional school systems, magnet schools, and it will force schools and school boards to have to make their schools competitive, that children will want to go there,
Yeah.
not
Exactly.
just because it's in this community, but what is the curriculum that you offer? What are the unique services that you offer? And yeah, we need mental health services in schools. We don't need police officers. We really shouldn't have metal detectors, you know what I mean, in schools. That's very scary. That doesn't feel like a safe environment.
Yeah.
So how it's very interconnected with the community work that also has to happen,
Yeah.
the anti-violence work that also has to happen. Um, but I think the main goal is to challenge this idea, this ingrained segregation of the zip code barriers, and
Yeah.
allowing that to maybe open up communities to be more integrated.
Well, I mean, one of the fundamental in the strength of the American democracy has always been that we had a school system that was integrated. Well, we had to fight for it in the civil rights movement, right?
Yeah.
But there was this belief that education, if children from different class or different groups went to school together, there was a sense of being a community. And I think that, the lawsuit that LAN it has launched, and the lawsuit that the African American community have to do with back in Brown versus the Board of Education, right, was to actually say, we're not living to the ideal of offering education to everybody. So we are an educated citizenship that has the same opportunity. So I think access to education opportunity is essential to our democracy, and at the macro level.
Yes.
But at the micro level is how are we impacting the future opportunities of kids, so they can go out and get a job and get an education. And I mean, not everyone has to go to college, but at least have the essential skills that they need to be productive members of society. So in that case, I mean, education, we can spend a long time talking just about the different issues that are connected to educational access and educational reform. But that's just one issue the LAN Foundation works on. So what are the other areas of policy work? And let me tell you this. I wanted to talk a little bit about the LAN Foundation because I think it's what the LAN Foundation is doing. And I am a board member of LAN, the Latino Action Network, which is the C4. We have been, is the arm that advocates, for policy change. But you are in the C3, which is the one that makes sure that those programs that we advocate for actually get integrated, created, and it creates institutional power. Because I think that we as leaders have to be very mindful about how do we create institutional stability for our community and for our issues. I truly believe that the LAN Foundation, what we're trying to do there is to create an institutional voice that gives continuity to building power and access to resources for our community. So what are the issues besides education reform that as a foundation, as an institution, you are working on?
So workforce development is a huge area that we work on. We have several programs under this kind of umbrella, aside from the women's resource centers. In tandem with the women's centers, we're actually going to start engaging in a Latina equal pay study. This is something that I am very passionate about, and that is bridging the pay gap for Latina women, which is at the lowest nationally. We're at 45 cents to the dollar to the white man.
In New Jersey, we are the lowest state. That's true.
Yeah. So we want to work to bridge that gap. There's a lot of, so we're doing some research, actually funding some research through the women and the women's centers to get an idea as to how we can work to bridge that gap. What are the policies? What are the programs that we need to have? What's working? What's not working? To help them have higher wage paying jobs. Right. And another program that we have under that, under workforce development, is the PSCNG program. There's a huge legislation, millions of dollars. Always, this is my favorite part. Millions of dollars going out to the community. This is for the Latino community. Right? So we're here doing that. Doing that work, but we're doing that work, and that is to ensure that there is Latino representation in this clean energy workforce, which is the future. So workforce development is a big area of work for us. Also health justice, along from our mental health agenda. We are also working on ensuring coverage for all kids, that is successful, that all children are actually reached and care is actually provided and coverage actually provided to youth. There's a lot of barriers to ensuring that all children are enrolled and cover all kids, regardless of immigration status. So we're actually going to be doing a little bit of messaging work around the changes in the ruling that the reversing of Trump's public charge rules. So we're going to start doing kind of like that macro policy work, figuring out some messaging so that we can let our community know that it's safe to enroll your children in care. And we are looking at ways to start ensuring all of New Jersey, right? Universal health coverage in New Jersey. That's something that we are working on the steps to build that policy work around that. And actually, in all the programs that we do, we are working at building our leadership, right? So within health justice right now, we're actually training a group of leaders to become health justice advocates and meet with people. So we have about We work in collaboration with Salvation and Social Justice and New Jersey Citizen Action. We have about 15 community leaders, 5 of which are the 5 young Latinas who are learning these policy and advocacy and organizing skills to then be the voices of tomorrow within the health justice space.
Yeah.
Another issue that I'm very passionate about based off my personal experience, I am LGBTQ identifying, and we're taking a stance on things of marriage equality and actually doing a little work around that and how accessible it actually is to everyone in New Jersey. We'll be releasing something soon in June, along with our partners at Hudson Pride and other organizations around this issue of marriage equality, and actually doing some work around not just is marriage equality accessible to same-sex couples, but is all the language at the community level really inclusive, right? So I'm actually about to get married in a few weeks to my future wife. And we go on these sites to figure out how to get married. Everything's like bride and groom, bride and groom. And I'm like, this is like, I was like, am I the groom? You the bride? Like, what do we, you know what I'm saying? Who's wearing the pants?
Language fairness, right? Language justice, how critical
So
that is.
yeah, and actually, what you're talking about, immigrant mental health, the article that I wrote was about the term Latinx, and how I think that there's been a lot of resistance to that term, but a lot of youth do identify with this term because we are in an age where it's safer to be out and to explore your sexuality and identity. And I think, unfortunately, we're still fighting kind of this homophobia and transphobia in our community. So this is something that I actively integrate and work at integrating into all the work that we do as the Land Foundation, because I know that some other organizations may not take that stance because it coincides with like their faith beliefs or their spirituality, and we're not tied to those things. So we see that as a basic civil rights issue. We're also working with Planned Parenthood around reducing stigma around abortion access and Roe versus Wade and sexual education. There's important policy work around that. And we have to be in those spaces. And at the Land Foundation, we may not be leading all of these issues, but we have to be in those spaces because our voice, we are what contributes to how that messaging can actually reach our community. So that's something that we're working on within the reproductive rights space of what is the message that works for our community to support this issue that directly affects them.
That's essential to elevate, because I also, one of my other hats, I do lead Latina Civic, which is an organization of Latina women who advocate for all issues of reproductive right, but also how we become more inclusive and welcoming of our LGBTQ plus communities, and how do they get connected to the struggles that we have now. I have a lot of respect for our founders and previous generations of Latino leaders who actually have to fight for their identity as Latino, Hispanic, Latino now young people want identify themselves as Latinx. And to me, it's a matter of just embracing what people want to feel they belong to and just welcoming them. So I commend you for doing that. One thing, as you spoke, it's triggering me, something that our dear friend Chris Esteves talks about all the time, that says when they ask him, what's a Latino policy agenda, right? And his response is easy, right? Everything is a Latino policy agenda. So that's what, when you talk about all these other connected issues, that's what came to mind, right?
Yeah, absolutely. Yeah, that's right. It's a kind of like Land Foundation, LGBTQ rights. It's like, yeah, LGBTQ rights. Like that's, when they come for one segment of the community, they come for all of us. And that's why I've been very triggered by this Roe versus Wade. I'm directly impacted. I'm someone who has experienced those issues and lived those issues and accessed those services, abortion services, that were needed for me, and it needed to be safe. And I don't want anybody to see anybody have to have their health put at risk. But once they start kind of rolling back abortion, then it's like, then there's birth control, then there's gynecological issues, then there's vaccinations for this, and we don't have a really good history about this. You know what I'm saying? Like we don't have a good history around reproductive and Latina women. We're quickly used unauthorized trials for study for birth control. Not that long ago, we were in the news for forcing sterilization of immigrant women in ICE detention centers.
Yeah.
So these things are very scary to me, and we should all be equally upset about this issue, these kind of issues of LGBTQ rights. We should be equally upset, even if it's not something you fully agree with. We should support those issues, because once they come for one community, they'll come for all of us. And this idea that it doesn't affect you, it does affect you, because you may not know who in your family is needing to live this life until they come out, right?
Exactly. And fundamentally, it's a human right. What gives another person the right to make your own choice? Like, that's negating the humanity of women, that we are not capable of making our own choices about our own bodies, about reproductive health, about our future. So fundamentally, it's that. But one thing that gets complicated in Latino communities is that connecting that right of women to make their own choices with religious choice or your religion. And I always said they're not the same, and we should not allow some of our religious belief, specifically, Catholic and evangelical.
I want that out of my doctor's office.
Exactly. Yes. I don't want doctor's office. Yes.
Yeah. And I don't want it. And when I go file paperwork to be married, I don't want it there either. You know what I'm saying? Like, I want my church and my spirituality in that building.
Yeah.
Okay, when I go there, not when I'm trying to do my everyday business. I don't know.
And
That's the stance I take.
if your values are guided by your religion, then that's it. That are your values, but don't impose your values on other women who perhaps have very much difficult decisions and difficult choices to make on their own. So I am right there with you, and we are Latina Civic are looking forward to working together to continue the process of education of how we talk about reproductive rights in the Latino community. So thank you for elevating that. So there's so much. I mean, like I said, every policy issue is a Latino issue, because with 20% of the population here in New Jersey, and nationally, I mean, we're growing. So how can
abolishing? Is one more thing, abolishing the drug war. Those are things that also, we are involved in. Cannabis reinvestment funds. A lot of Latino organizations steer clear of that, because of stigma and things like this, and we're also working to break that down.
The issue of cannabis, the implications of the legalization of cannabis, without, how that impacts our community. I know you're doing a lot of stuff on that. So if people want to get involved with the Land Foundation, and they have a question of any issue that impacts our community, how can they get in touch with you?
So you can reach out to me directly. I actually answer the emails for info@landfoundation.org. So if you reach out directly, like I'll be getting those emails directly. You can go visit our website, engage with us on our social media. When we have events, come check it out. A lot of our events are virtual, and you can kind of learn more. We also have a YouTube channel online where you can kind of watch some of our past events. We were involved with you as well, Patricia, around redistricting and apportionment, and making sure that our community is represented and engaged, civically engaged in those issues. So check us out, Latino Action Network Foundation. Search our YouTube, our Facebook, our Instagram, Twitter at Dr. Jesselly, and website www.landfoundation.org.
I encourage the listeners to think of the Land Foundation as a resource center. Like, if you have a question or concern, they have organizations working on every possible issue that you can think of. So if they're not servicing within the foundation, there's organizations that are on the board who are servicing different communities. So reach out to Land Foundation and get engaged, because we are the future. New Jersey and this country is going to be majority minority in the next 25 years, and that has implications.
Yeah, the global majority, right? That's what. And I really get frustrated when people are like, "Oh, Latino community, it's a new growing community." It's like, how long are we going to be new? You know what I mean? I want to know how long before.
We're here. We're part of it. We're the future. I totally agree. So stay connected, get engaged with the Land Foundation. We're going to send you all the information, how to connect with them, take action, sign up so that when they have an action, you can join us. It's only together that we can build power, and it's only together that we can build institutions that, like the Land Foundation, that create a platform for the future generations of Latinos to actually be able to exercise their power and be able to have a voice in driving the policies, their government, and our institutions and our schools. So get engaged, connect with the Land Foundation. Thank you, Jesselly, for this a wonderful conversation. I know we could talk for 2 hours,
Yeah.
but we only have 45 minutes, 50 minutes to this conversation. But I just wanted to thank you from the bottom of my heart for the leadership that you are providing to the Latino community here in New Jersey, and just for the vision that you have about how we can integrate and service all the needs of our community, because we are just part of the society at large. So thank you for your leadership and your vision. Yeah.
Thank you.
Yeah. Join us, sign up, Activista Rise Up. See you next time.